What's up, everybody? My name is Eric. Welcome to my channel, Pace the Pants. Today, we're going to be going through a new lecture series, and we're going to focus on anatomy to start, but we're going to have various lectures coming out, so stay tuned. Look for EOR lectures, didactic lectures, clinical lectures, various topics, pulmonology, lung cancers, orthopedics, pediatrics. We're going to go through NCCPA blueprint topics that are on the PANCE and on the EOR exams. We'll focus on content that will prepare you for your didactic and your clinical education. Today's lecture, we're going to focus on anatomy. Now, we have various anatomy lectures coming up, so stay tuned. Today, we're focusing on anatomical terminology, planes, different movements, relationships to one another. So you can always click and watch various lectures, whatever you may need. And these lectures will have different levels for everybody. So this may be a lecture that you're already familiar with. For others, this may be a new concept. Maybe you haven't taken anatomy in a while, so this could be a good refresher. So let's go ahead and get started. So, a little message from me. This is part of our lecture series, as part of the PA review series. So, Pace the Pants here is striving to provide you with high yield evidence based content for all of your medical lectures and as a supplement. Today, we're focusing on anatomical foundations and just an advisory notice. All right, so let's get started. So, introduction to our course, and let's go into some anatomical terminology. So, we'll start with an outline, basically going over the goals of our course. So, we're going to go through every single body system for the Anatomical Foundations series, and we're going to cover today just the more basics anatomical terminology and different movements and planes. So, some learning outcomes. We want to understand anatomical terminology. We want to know some of the basic bones, the skeletal structure, some of the joints, major organs, muscles, the relationships, some of their functions, and the innervation, circulation, various topics with arteries and veins coming up. Today, we'll also be going through some MRIs and some CT scans, so stay tuned. And we're going to break up the structure of our course into 3 different blocks. Block number 1 will cover the thorax, abdomen, pelvis, and perineum. Block number 2 will cover the back, upper limb, and the lower limb, so that's more musculature. And then block 3, because it is so dense, we will go over the head and neck together. All right, so some basic anatomical terminology. So what you can see here, some of the muscles underneath the skin. We're going to go into this in more depth soon, so let's go ahead and do that now. All right, so you often hear names such as collarbone or shoulder blade. There are more technical terms for those, so depending on your anatomy course, you may need to know some of these more particular terms such as clavicle or scapula. There are eponyms, which we are tending to move further away from. So we have the fallopian tube is an eponym that's commonly used in clinical practice. You may still hear this from surgeons on your rotations, but there are more specific terminology that anatomically describe the specific landmark that you're interested in. So we'll come across eponyms, and there'll be another one's the sphincter of Oddi, and that's more near the pancreas and the duodenum. So we'll come across these eponyms, and we'll talk more about them later. And then just in Latin, nomina anatomica. So a lot of the anatomical structures are based off of Latin. And so if you kind of break apart those medical terms or the anatomical terms, you'll often be able to elucidate what those terms are and how to describe it for the human body. Okay, so anatomical position. We always describe anatomy relative to its anatomical position. So the reason why this is important is because if you are going to, for example, do a amputation, you need to understand your rights and lefts. You need to understand that a leg is different from a thigh, and you need to know proximal, distal. So when you're working on joints, let's say you're in orthopedics, you need to know the relationships from one joint to the next. So for anatomical position, we are often in this type of position here. And so you can see that we have more of our hands are shown more superficially, um, where our palms are facing anteriorly, um, and then our elbows are extended. They're not in any kind of flexed position. The knees are extended too, also not in any flexed position. And then our head is erect, the penis is erect, and the toes are pointing forward with the feet together. So this is super important because we're going to always refer back to anatomical position when we move forward in the next lectures. Okay, in terms of anatomical directions, we have proximal, distal, superior, inferior, anterior, posterior, medial, lateral, palmar, and dorsal. So this is a good picture here just to kind of get you oriented. We have a median plane, and so everything on the left-hand side of the screen is the right-hand side of the body. Everything on the right-hand side of the screen is the patient's left hand and left side of the body. So we always describe left and right based on relative to the patient. So we have superior, we have inferior, uh, similar terms to proximal and distal. For example, if we're talking about the thigh, we can have a more proximal portion, and distally, we reach closer to the knee. Anterior, posterior, that's very helpful as well, especially when we're talking about specific organs. We can talk about different services of the organs. There's anterior portions and posterior portions. For the palm, palmar, dorsal, and then for the feet, sometimes we even say things, for example, when we do actions, there's plantar flexion and dorsiflexion. So understanding the sole, understanding the dorsum, all of those terms are going to be very helpful for you. Here's another example of anterior and posterior. Sometimes they also may say ventral. Directionality, again, we have superior and inferior. Sometimes, based on embryology, we may hear terms such as caudal or cranial, very similar terms to superior and inferior. Those terms just describe the specific relationship when the patient was in embryological development. Our origins are a little bit more different than our anatomical specificity we have here. We have medial and lateral. So depending on where you're looking, for example, on this side, if we're talking about the patient's left arm, more laterally, you may have a different portion of the clavicle, for example, or if you run more medially, that clavicle runs into the sternum. So you have a sternoclavicular joint versus laterally, you have a acromioclavicular joint. So median towards the midline, medial is towards uh, as you're heading towards the midline, and then lateral is when you're moving away from the midline. So the median is right down the middle, and then medial is when you're heading towards the midline. Again, you have proximal distal for both the upper and the lower limb. Superficial or deep are also specific terms. So let's say you're starting along here in the vertebrae and you want to move more anteriorly. If you're starting inside the body, you can work your way more superficially. Or if you're in the anatomy lab and you're starting superficially and you need to make cuts, you can move deeper in. So you also have superficial and deep depending on where you are anatomically, and they are similar to anterior and posterior. Okay, and then we also have some directions. So we have superficial and deep, like we've been talking about. So there's superficial muscles of the back, and then there's more deeper muscles of the back. Palmar and dorsal, like we talked about earlier. So the palm, more of the ventral or anterior surface versus the dorsum is more of the posterior surface. And then same thing for plantar and dorsal. We talked about the sole of the foot versus the dorsum. So the sole is our plantar. So when we have movements, we can plantar flex or we can dorsiflex. You may hear colloquially someone say extend the foot. but really it's plantar flexion and dorsiflexion. We'll talk more about those terms soon. Okay, so for anatomical planes, we can break up the human body in different cross sections. So if we do a nice midline cross section right here down the middle, you can have what is called a sagittal cross section. So you make a cut right down the midline of the patient, and then you look from a more medial surface. This is the medial surface of their body. We're looking in the inner surface of their brain, so that would be a sagittal cut. You can make these cuts continuously in many different sagittal planes, but there's only one median plane that runs right down the middle, but you can have various sagittal planes that run parallel to that median plane. If you're going to cut the patient in more of a front and back or anterior posterior relationship, this is called coronal cross section. So now we're taking this patient and we're going to do slices that run from anterior to posterior or from posterior to anterior. Those are called coronal slices. And I'll show you some more slides on this. And then you can also have a transverse cut, which is a horizontal cut that runs right through the midline of the body. And you can have various cuts here as well that run parallel to one another. So these would all be transverse cuts. And so you can see here, oftentimes with CT scans or MRIs, we have more of these kind of planes. And then here also with an MRI to see the contour of the brain, this is sagittal. So we talked about sagittal. So you have one median plane right down the middle, and you can have various sagittal planes. Technically, the median plane is also considered a sagittal plane. So that can be a trick question on an exam. Sagittal, though, runs parallel to the median plane. So you have two examples there. Transverse, like we talked about, runs right through the more horizontal plane of the patient, and you can have multiple cross sections here as well that are parallel to this transverse plane. So you can do various cross sections through the body. When you're looking at a CT scan, that's exactly what we're looking at. We're looking at various hundreds and hundreds of cross sections, one transverse section at a time, to look at our CT scan or MRI. And so a transverse plane is always considered perpendicular to the long axis. So you can actually have a transverse plane through the foot as well, as long as you understand that a transverse plane is perpendicular to the long axis of a bony landmark. So when we're looking at the patient in anatomical position, our transverse plane runs perpendicular with, for example, our femur, because it's a 90 degrees cross section. So the femur is running up and down, and we're going to do a cross section right through that. However, your foot, think about the different perpendicular orientation it has to, let's say, the femur or the tibia. So then your transverse plane would be a little bit different too. If you have questions on that, you can reach out. Coronal plane, like we talked about, is moving from front to back or back to front. So some anatomical terms for movement. We have various terms that we can use to describe. So we have abduction, adduction, which is adduction, lateral rotation, medial rotation. You can have internal rotation, external rotation, pronation, supination, circumduction, eversion, inversion, protrusion or retrusion, elevation or depression. So just to give you a couple examples, you can abduct your shoulders, which is what we often think when we're moving our shoulders out to the side. You can flex and extend. So that's when you bring, for example, you're doing a bicep curl. That would be a good example of flexion, versus extension would be a tricep extension. Circumduction is moving at a joint that can do various movements. So, for example, your hip can do circumduction, but your wrist or your elbow, for example, cannot do circumduction. Your elbow can only do flexion and extension, so it cannot move in multiple different planes. Okay. And then elevation, depression, an example of that would be your trapezius or muscles that can act on the scapula that can elevate or depress the scapula. More movements like we talked about, flexion and extension, bending in or straightening in a sagittal plane. So you can flex or extend your arm, you can flex or extend your forearm, you can flex or extend the wrist, flex or extend the knee or the leg. Um, so various different types of flexion. And then here's a great example of dorsiflexion versus plantar flexion. So dorsiflexion, like you're going to kick a door open, you're going to need to pick up your foot and dorsiflex it if you're going to properly kick through that door. Versus plantar flexion is you want to step in the plants, so you need to push down into the earth. That would be plantar flexion, like if you're driving. Okay, various movements. Onwards, we have abduction and adduction. Abduction is moving away from the plane of the body, versus adduction is bringing the peripheral limb towards the body. Um, so yeah, we have a couple examples of abduction and adduction here. Other movements, we have rotation and circumduction. So like we were talking about earlier, circumduction is moving the limb in a circular motion. It's a combination of many other types of movements. So for example, your hip can circumduct because it can do flexion, extension, abduction, adduction. There's a lot of different movements that it can do, as well as the wrist. But your elbow is more limited. One other example here is the medial and lateral rotation. So oftentimes it's similar to internal external rotation. So as long as you're coming more midline, that's medial rotation. If you're moving outwards, that's going to be lateral rotation. Internal rotation would be, if for example, if you're going to test your rotator cuff muscles, some internally rotate and others externally rotate. Your forearm can pronate and supinate. So if you're going to hold a bowl of soup, that would be supination. If you're going to do the opposite, turn your hand over, that's called pronation. And then you have inversion and eversion of the foot or the ankle. We'll briefly go over some of the axial skeleton. We'll have another lecture where we go over bony anatomy, but just to give you a brief introduction, you have arm, forearm, you have thigh and leg. So oftentimes I hear confusion. People will oftentimes call the thigh the leg. However, the thigh is the thigh and the leg is the leg. So I often just hear leg for the entire lower limb, but it's actually separated by thigh and leg. So if you're distal to the knee, that's your leg. If you're proximal to your knee, that's your thigh. Same with the arm and forearm. If you're proximal to the elbow, that's your arm. If you're distal to the elbow, that's your forearm. Yeah, so we won't go through all these bones today, but we will go through them in future videos. Of course, there are other systems of the body, and when we go through more of the larger organ systems, we'll go through them. But for example, there's the nervous system, cardiovascular system, musculoskeletal system, integumentary system. So I'm briefly going to talk about those today, just to kind of introduce them, since today is more of an introductory lecture, and then we'll dive into more specifics when we come across them. For example, when we go through the nervous system, we'll go through cranial nerves. When we go through dermatology, we'll go through more of the integumentary system. Okay, so for the neurovascular or the nervous system, we have the brain and spinal cord, which make up the central nervous system. And then everything peripheral to that is what we call our peripheral nervous system. Cardiovascular system, we have various arteries and veins. If we start with our heart as the main pump, we have blood going to the extremities from our arteries, which then become into arterioles. We have blood returning to the heart via veins, and those came from venules. The portion where the arterioles and the venules meet, that makes up the capillaries, and that allows for exchange of multiple different nutrients and transfer of oxygen, and also transfer of CO2. We have our musculoskeletal system, which we're focusing on largely today. We've introduced some muscles and some bony landmarks and the different planes and movements that describe the relationships of the muscles and the bones. Examples we said earlier: proximal, distal, medial, lateral, sagittal, coronal, etc. So the musculoskeletal system has various functions to support, protect, and provide movement. Muscles can be skeletal, cardiac, or smooth. We're focusing mainly on skeletal muscle. If we talk about cardiac myocytes, we can talk about cardiac muscle. If we're talking about GI, we can talk about smooth muscle. And then also the musculoskeletal system is made up of bones and joints. Integument system, we are only briefly talking about today. We'll go into more detail when we go through derm. But there's skin, nails, hair, various functions to protect against the sun, provide as a barrier to prevent water loss, excretion of waste, temperature balance, detection of touch, pain, and the synthesis of vitamin D. Here's an example of the epidermis, dermis, and the hypodermis. And then various parts of the skin here as well. I mentioned earlier that we were going to go through some medical imaging techniques. So here we have some radiographs. I provided x-rays for you to look at. So we can look at the x-ray of the hand here. You can see the carpal bones here. There's metacarpal bones. And then there's also phalanges. Here we're looking at a chest x-ray. Again, on the left side of the screen is the right side of the body. And on the right side of the screen is the left side of the body. And you can see your cardiac silhouette here in the middle, clavicles up here, and you have your diaphragm located here. And then there's also ribs located here as well. You can see some of the pulmonary arteries and veins located here. Yeah, so x-ray is a good source. You can look at bony fractures. It can pick up some soft tissue. For example, if there's a pulmonary nodule in the lungs, a CT scan can also look for those kind of things too. And typically an x-ray is cheaper and more first line instead of ordering, for example, something like an MRI. You also have CT scans. These are good because they can actually be used to, they're quick. You often see these in practice when you're in the emergency room, and they provide a lot of meaningful value over the x-ray, which picks up more bony fractures. The CT scan also can do that, but it picks up some soft tissue as well, so you get a better image, and you can get various different horizontal or transverse cuts through to look at whatever you may need. And you can also have like CT angiogram, and that could put dye, for example, into the vessels so that you can actually see them light up when you're looking at your CT angiogram. And then there's also MRI. These are the best for soft tissue. So, for example, if we need to look at the brain, we can order an MRI and make sure that, there's different kinds of, you can use a CT scan as well, but MRI is the best in terms of finding soft tissue, or, for example, a tear in a particular ligament, like an MRI to look at a ACL tear. Okay, so we're going to do a few review questions. So first question is located here. In describing the relative positions, A is blank relative to B. So A here shows the metacarpals, and then B shows the distal phalanx. Go ahead and think about that, and we'll go through the answer at the end. I think we have 4 or 5 questions. Number 2, this is a CT slice in which section? Do you think it's coronal, sagittal, transverse, median? Okay. Next, this is a blank cross section. Do you think it's sagittal, median? Do you think it is a transverse? Or coronal? What kind of plane is this one? This is looking at the brain. You can see the midbrain pons and the medulla and the cerebellum. A is blank to B. Is A superficial to B? Is A deep to B? Is A anterior to B? Is A posterior to B? Is A medial or lateral to B? And then finally, the left knee is blank and the right knee is blank. So think about terms like extended or flexed. Okay, so let's go through it. So in describing the relative positions, A is more proximal to B because A is more superior or closer to the cranial position. B is more distal because we always think about anatomical terms. So you have to take this picture back and relate it to your anatomical position of anatomy. This is a CT slice in the horizontal or the transverse plane. And this was through the, you can see the heart here. So these are the lungs. And you can see some ribs over here on the sides and the vertebrae posteriorly. So this is anterior, and then down here is posterior. This is a sagittal cross section, like we talked about earlier. We talked about the brain. You can see the vertebrae here, the nose anterior, this portion of the brain with the cerebellum posterior. And then A is superficial to B. So A is more anterior to B. You can see that this is either the muscle, the bones here of the forearm. So you have your ulnar bone and your radial bone. We'll go through the bony landmarks later, but you can see there's more muscles proximally, or more muscles located ventrally. And then you can see the median nerve in here and neurovascular bundle. So all of this is located more anterior, and then posteriorly, those muscles are not as profound. That's the forearm in a transverse plane. And then lastly, the left knee is extended and the right knee is flexed. Okay. That is everything for today. Thank you for tuning in. And we will have more lectures like this moving forward. We're going over different topics. We'll go through, um, today was more of an introduction, so it was a little bit more foundational, but we're going to get very complex here very soon, going over a lot of detailed content for specific topics. So we're going to have an anatomy series running, and then we're also going to have various topics covering EORs, didactic, clinical, PANCE, PANRE, various content coming your way. Okay? All right. Thanks for tuning in, and we'll see you next time.